Dr. Jonathan Tripp is playing musical chairs this morning. Is that comfortable, that stool?
That'll work great for me. Let's see.
Yeah,
I don't know, Cameron.
we're,
We,
we're we're playing musical chairs because of
we
uh,
have an extra guest today, a new one that I'm really excited to tell everybody about. And she's working her way here. It's her first time to the radio station, and I got her lost. But um, we have a new physician assistant that we've
your
just
staff has
hired.
been growing by
Yeah,
leaps and bounds.
yeah, we continue to grow. We're bursting at the seams, so we're looking for that benevolent benefactor that wants to help us build a building because we are growing like crazy. But it's just a lot of fun because we've had a lot of people waiting for us to get a female provider. We had a very part-time one that left in April to go to Arizona, and we've been searching. And we've had a couple that we've really thought were good choices, but Lauren, that's her first name, and I'll introduce her when she gets here a little bit better. But she is just a natural fit.
Out of Montana.
Yeah, she's actually originally from Minnesota and did
Oh, this is
her.
balmy weather to her.
Yeah, yeah. No, in fact, she told me I didn't need a coat this morning, so that's correct. It's normal for her. But she graduated from undergraduate school in Minnesota and then came to Idaho State University for her master's degree in as a physician assistant program that she completed there, and graduated among the top of her class. So we feel very lucky to have her. She worked in Montana for about 3 years at a community health center, and so that's given her good depth and breadth of training. And then she's been in the Magic Valley for about a year and a half.
We should point out that these people coming to your office, you mentioned one of them leaving for Arizona, but she had worked in Buffalo at Roswell Park. So
Yeah,
you were bringing a lot of cold weather people into Idaho, and so there must be somewhat of a prerequisite for this job.
it is. They have to have lived in cold weather because then they think Twin Falls is all just easy stuff.
I thought that
So
my first winter here too as well, but
grab a headset.
it didn't particularly last. So we have to tell the newcomers that the headsets do mess up your hair.
Oh, no.
So you'll have to if you're going to be guesting a lot, you'll have to be bringing a brush. Uh,
Afterwards.
well,
Yeah,
I
no,
don't have any choice.
yeah.
But
They don't ask me to fix their hair afterwards. So in fact,
I tend to usually wear a ball cap for that reason, just because when I get up at 3 o'clock, you have bedhead, and
you don't worry about it. You just wear the ball cap.
yeah,
That's true.
being in radio too, no one sees us, but we do want to welcome Lauren into the studio.
This is
And
Lauren Bostrom, official PAC, which stands for Physician Assistant Certified. Is that right? Did I say
It
that?
does, yes.
Okay. So I just got done telling where you came from, where you went to undergrad, where you went for your master's, and how you've been to Montana and hanging out in the Magic Valley for about a year and a half, and how, I said mostly good things about you while you were gone.
Oh, that's good. Yeah, minus my directions aren't always the best.
That's
But
awesome. Well,
um,
go ahead. Tell us a little bit about yourself. I gave them the quick stuff, but I also thought it'd be great for Lauren to give our listeners a little bit more detail about what physician assistant training really is, because there's a little confusion.
Mhm.
Are they doctors? Are they, what do they do? Because when I talk about practitioners in our office, any of our practitioners, can prescribe medicines, can refer you to specialists, do the procedures that we do in our office, like joint injections or um, skin biopsies, all of those things they can do, and they do it under their license and my guidance, and so they are, you know, full practitioners, and yet the way the laws are set up, they have to have a physician that's supervising. But other than that, I'll let you talk.
Well, before you do that, we got about a minute before the first break, so we'll just ask. You were for 3 years at a community health center,
yeah,
and that's a little bit of a different animal, isn't it, than maybe working in a doctor's office?
it is. We take patients from people who are homeless, underserved populations mostly, whole different groups
Young
of
radio
people.
broadcasters with no money.
Yeah, exactly.
Yes, no, pediatrics to nursing homes, and we see as many people as we can and try to give everyone the health care that we feel they deserve. So
For a lot of people, it's really the for many of them maybe the only health care they often get.
It is, and it's pretty amazing that we were able to offer those services to people who literally didn't have a home.
But it's like
And
a boot camp for medical training, isn't it?
it is. You get to do everything right away and learn really quickly.
So you see people coming in who've got, I would think, diseases related to maybe addiction issues. Also, though, just to maybe have issues. We talked about dentistry a few weeks ago.
Yeah.
You name it. They've got, or they've been out in the cold and they've got frostbite issues. Any number of things.
Yeah, you just don't know what you might come into. Usually really sick because they haven't had health care for many years, and so you have the chance to kind of try to get them caught up on everything.
We've got more coming up in just a couple of minutes. We do want to point out Dr. Tripp is joined this morning by Lauren Bostrom, and we've got a few more minutes to talk after the break. Actually, that's the lion's share of the program this morning. In the meantime, it's up to 29, and for Lauren, being a Minnesota native, that's what they call like Miami like. So she's here in the balmy weather of Twin Falls, Idaho. Our guests are joining us until 9 o'clock this morning. It's called Better Health with Tripp Family Medicine. The slogan, Life's Too Short Not to Feel Good. The office on Fillmore Street in Twin Falls, directly across from the main post office. A little side note, we were mentioning Lauren Bostrom is here with Dr. Tripp this morning, and she hails from Minnesota at one time, and I debated it. I looked at the weather forecast, and some days I come in either wearing my Golden Gophers hooded sweatshirt or sometimes my North Stars hooded sweatshirt. Uh, that was a travesty. They moved to Dallas. And then number three, sometimes I will wear the Vikings hooded sweatshirt. So I've got a couple of those actually. It has nothing to do with. I've never lived there, visited. That was it. But that was some of my sports teams when I was young. But we were talking a little bit about your background, Lauren, as a physician assistant. What is the training? Because as the doctor said, a lot of people haven't figured out the difference between MD, PA, even nurse practitioners. Confuses a lot of people.
So as part of our prerequisite for going to PA school, we all have to get our undergraduate bachelor's degree, which I got mine in biology. And then we go on to 2 years of straight training. That's all we do. The first year is in the classroom, learning about all these medical conditions. But then we really hit the trenches our second year and go on rotations ranging from OB-GYN, pediatrics, ER, surgery, even. The difference in training, a lot of people wonder about nurse practitioner versus physician assistant. Our training is based off of the medical model, so it's very similar to the physicians that we practice under
Mm-hmm.
as our supervising physicians. And so our medical thinking and training, as well as that hands-on clinical experience, is really important for us to be able to provide excellent medical care.
Well, you make diagnoses though, just like anybody else would in the office. I mean, you
Mhm.
do that, and you can refer someone to a specialist.
Yep. Most family practitioner PAs, we take in our own panel of patients. We're able to diagnose, treat, refer out, and really do most of what a physician in the office can do.
I know
So,
that for many years, going back probably to the early '80s, I walked into my old doctor's office. I grew up in a small enough town where the doctor I had as a teenager and a young man had been the doctor who delivered me when I was a baby. But I remember in my early 20s going into the office, and the first time I met a physician assistant who took care of me that particular day during that appointment. And I got a little bit of a background. He explained, of course, medicine was different. That he could take a few minutes and explain to me in the office
Yeah.
why it was different back in 1981. But it definitely has broadened the ability to care for populations. I would think dramatically through the rise of PAs and NPs and the like.
yeah, we've been as a physician assistant, kind of how they started was this need for healthcare and not enough people getting through the medical program, and so they found ways to train to the same similar level of healthcare to be able to kind of reach populations in a greater degree because that healthcare need is definitely rising, and there's a definite need for more family physicians out in this area and in other areas as well.
I was going to say though, there's a lot of consultation that goes on in the office between all of the different folks that are on the
Yeah.
job.
And I think our office is a little unique in that we literally all sit together in the same room. And if we have any questions or thoughts, I often am asking the different practitioners for ideas if I am just looking for alternatives or struggling with an idea on a patient of how maybe a different way to approach something. But I'll give you some examples. Just over the last several weeks, we have had a rash of terrible diagnoses relating to cancers and life-threatening situations, most of which were found or identified by one of our physician assistants. So, to say that they aren't able to do what a doctor does is not true for the most part. The real difference is like with my training, I had 4 years of medical school in addition to undergraduate, and then I had an additional 3 years of residency, all of which put me in very intense training situations, long hours, late nights, all nights, and really just gives me that much more experience. And that's why with the physician assistant, they ask to, or are required to have a physician that supervises. But a lot of that is to make sure that where they're going, what they're doing is on track and consistent with a physician's training. And so uh, I have very, very bright people working with me, and as we sit together, um, they'll ask me, I'll ask them, and if I hear that they're struggling with something, I can sometimes give them a little bit of experience rather than just outright knowledge, and that's where the art of medicine comes in, is with that experience. So it's a unique situation, and as Lauren talked about, often the physician assistants will have what they call their own panel of patients. In other words, their own patients. And we do that to a large degree in our office, but we really share everybody. And so the patients that come in, they may prefer Lauren, they may prefer Jeremy or Russell, or they may prefer me. But the truth is if things aren't going pretty straightforward, immediately we interact, and often the patient isn't even aware that I'm involved in their care if they think they're with Jeremy, or they're not aware that Jeremy is involved with their care if they've only seen me. So it really is a shared practice, and I think that's the best.
Jeremy, no, actually, it was Russell a few weeks ago told me that he took the PA route because he said he didn't want the debt that you have, doctor.
He's got a great point there. He has no debt any longer, and I still do, and I've been out a while.
And Lauren, if from your standpoint, probably you wanted to be in a field like this since you were young,
Yes.
and so you go off to school, and then you've got to make similar decisions at some point, right?
Yeah. Where you have to kind of decide which track to go and what direction you want to be on. And I knew I was ready to start seeing patients quickly, and I like the idea of being kind of a hand to help provide healthcare.
I know back in the early 1990s, I used to interview a fellow every month about jobs, and he was a labor analyst, and we would talk on a monthly basis about unemployment rates, and he would always tell people, if you're looking to be, how shall we put it,
Recession proof?
right, that pursuing medical professions was the direction to go, and that's probably still true, isn't it?
It is. It is still true. In fact, we feel blessed is a good way, but very excited to have Lauren kind of stumble across our path, because we've recruited, we've come close on a couple of occasions, but almost immediately in talking with her, I knew she would be a perfect, we have yet to see, but a very good fit for our practice and our patients. I told her last night, I said, patients are not going to have a hard time feeling comfortable with her.
Um, we had a young lady in studio from Canyon Ridge High School last week talking about an issue related to their school and public safety and the like. She was telling me that her plans are to be a nurse. And again, she's probably 16, 17 years old, but has been thinking that way since she was little. And was there any of that in your background?
Um, as far as when I was younger, I had always knew I wanted to be able to take care of people. I guess I was sick quite a bit, so I don't know if that somewhat played a little role in that, being comfortable in the medical field. But I went in as a CNA nursing assistant when I was younger to kind of help get that some experience,
Hmm.
because I knew in the end I wanted to be looking at some sort of medical training as a provider for people.
The doctor referenced,
Mhm.
medical school and then residency and the like. How does that differ from what you did?
It's shorter, so that's nicer. It's still very intense. It's still kind of the same long hours that you do, and you're doing it. You're learning a lot in a short amount of time.
Drinking
To
from a
do,
fire hose.
yeah. But yeah, it's. I mean, I have to give credit to medical doctors out there who spend a lot of years
Do
training.
you do residency though as well?
So it's interesting. So we do our year of clinical rotation, which is kind of similar to the residency, but a lot shorter.
Hmm.
And then we are thankful for a lot of the people when we first start working who are there to kind of help us gain more and more knowledge through practicing and that hands-on experience too.
Yeah, and I would say in particular with Lauren's experience at the community health center, she's seeing diseases that are further advanced than most general clinics are because these are people coming that have been avoiding or haven't been able to afford any kind of health care. And so where you might come to the office because you've had a little pimple slash boil for a day or two, these are people that may have suffered through 2 3 weeks and now their limb is at risk. And so they really are getting kind of the fed from the fire hose as far as experience in a community health center. So for her particular experience, I think is excellent that she brings to the plate for our clinic. But the having a physician supervisor is what really kind of transitions a physician assistant from book work and watching and playing doctor, so to speak, to really being the practitioner and being able to provide good care in the clinic.
We're going to talk in a moment about new blood pressure guidelines and screenings. Do want to point out quickly, say 53, and of course, Tripp Family Medicine joining us in studio on News Radio 1310, KLIX, newsradio1310.com, and we're at 30. Also, there had been some confusion about the recent peel party, which means talking about skin peels and skin treatment. Some people thought it was pool party. That was actually last summer. Uh, so
yeah.
we wanted
This is not a pool you want to jump in.
not this time of
Just
year.
lightly applied.
So we wanted to mention that very quickly, but that was a big success in the past week. But in the meantime, you have a note here that you had sent me much earlier this morning, Doctor, about it says new guidelines for high blood pressure. And I had briefly read about this as well yesterday.
I got to throw in one more kind of housekeeping item. We have been doing for the last month or so a winter coat drive that's going to go mostly to children, but we're taking for children and adults. Today is our last day of that. We've had a lot of people bring in stuff in the past few days, and our little front foyer between the two front doors is getting pretty full of coats. But at the same time, we will take anything that you have as long as it's not falling apart because it's going to go to those that don't have them. And this morning's a good reason to remember that, having a coat is a beautiful thing
Yeah.
to have. So if you could do that, it's at our office. It's across from the post office on Fillmore and anytime before 5 p.m. So please do that. But moving on to blood pressure,
Hmm.
it's going down. The guidelines for what is considered normal blood pressure for years, has been 120 over 80. But we were advised not to worry about treating people until it was 140 or over 90, those two different numbers. And what just came out about 24 hours ago, so this is hot off the press, so to speak, the American Heart Association, American College of Cardiology have said, looking at things, especially for the last 3 years and retrospective views of studies, that they've really found that that difference between the 120 and the 130 on the first number in your blood pressure makes a big difference. In fact, especially if somebody has other conditions like diabetes or any kind of heart disease or circulation problems, it pretty much for the general population doubles their risk or doubles the problems that they'll have associated with that just by having 10 points higher. So what most people think, oh, it's only 135, it's not 140. What you're finding is that's doubling your risk for some scary things like heart attack and stroke and what's called congestive heart failure, even circulation problems. We frequently talk about swelling in the lower extremities. And at first, it's just annoying, but it gets to the point where the skin breaks down and you don't have good circulation, and then you get ulcers, and then we talk about, you can't walk, or do we amputate? So things that, we've also often talked about hypertension as a silent killer. It's more than a silent killer. When you get a stroke and you're debilitated, you're not dead, but some people would wish they were. And so it's really important for us to work on blood pressure. And I know we're really short on time. Uh, this is, interestingly enough, not really, we're not going to double the amount of people that have blood pressure medicine, but the real recommendation, especially if you're over 120 but below 130, is do it with diet, do it with weight loss. And this is probably the biggest push for us in almost any chronic illness in our office is let's get some weight down because the weight affects everything. It affects your blood sugar, your blood pressure, your cholesterol, all of the things that contribute to things like kidney failure and heart failure, stroke and heart attack, and neuropathy, which is the numbness or burning sensation to the hands or feet or other areas. These are the things that kill us or make terrible quality of life. So if you need some help or would like expert professional help with diet or exercise with true medical guidance, come see us at Tripp Family Medicine. Any of our practitioners will be able to give you some really good guidance on
You're online
how to
too, as
do
well.
this.
You're online, and they can call the office.
That's true. Our office number is area code 208-933-4400. That's 933-4400. On the web, we're trippfamilymedicine.com, and for sure you can reach us on Facebook at Tripp Family Medicine. So that's the quick and dirty on the new updated guidelines, and let you know that between the 4 practitioners down at our office, we keep each other up to date.
I want to thank both Lauren and Jonathan for coming by today. And Lauren, we're glad to welcome you to the rotation. It's like having 4 starting pitchers again.
It is. We have a full rotation.
We have to take a short break. News is coming up in just a couple of minutes from the Fox Radio Network. It's 30 right now. Bill Colley with you as well. On Top Story on News Radio 1310 KLIX and newsradio1310.com.